is over, those dorms will be restored to their original state, and they will be made available for UNC Charlotte and their students.
Deena, is it only the 6 dorms from W?
So currently there are 6 dorms that have been vacated by UNC Charlotte students. Those are the dorms that we will be using initially, and then we will continue to evaluate when and where additional capacity will be needed.
So will actual patients be staying in the dorms, or we had read that there were also possibly for like emergency personnel that would stay there, like hospital staff?
No, we're trying to provide hospital bed capacity, and so these beds will be used for hospital patients.
This is Derek with Fox 46. I have a question for CMPD in regards to the gray area. How many people are really kind of trying to exploit this gray area? And I mean, how many visits have you guys had to make? And also, you mentioned you guys are issuing citations. There was the press release that went out a little bit earlier this afternoon in regards to that massage and day spa that was cited. How many citations have you guys basically sent out?
Yeah, so far, to answer your last question first, so far we've only needed to issue the first citation, but I don't think that's the end of it. I do believe there'll be other businesses who seek to, exploit what's going on and change their modes of operation to now say they're operating as grocery stores or convenience stores because they sell water or chips. So I don't believe this is the last of it, but one so far. You asked me how many people are in the gray area. I don't know a specific number, but I do know that there are those folks out there, both businesses and citizens, who are looking to believe they're exempt when it's been very clear from the very beginning. This is a serious worldwide pandemic. If you don't have to be outside to take care of an essential job function or for survival, don't go outside. Doesn't take very far to look to see people who, in my opinion, clearly aren't taking that seriously.
Hey there, Deena. This is Hunter with WCNC. One of my colleagues did a report, of course, after finding some records showing that the county went into crisis mode without notifying the public. Can you explain why that happened?
Sure. We have a crisis management plan that the county uses to manage how we move forward in a crisis situation. And the crisis management plan is really an internal mechanism that we do to allow us to begin our planning. And so on that date, we did trigger our level 2 crisis management situation, did notify the board that we were moving in that direction. And then I believe it was 2 or 3 days later, Gibby made her first press appearance before the public to give us an update on kind of where we were. If you remember, when we went ahead and triggered our crisis 2, our level 2 crisis management situation, we hadn't even had one case here yet in Mecklenburg County. But we were anticipating that we were going to have cases. So that allowed us to elevate our game, start the planning. That allowed us to rent the hotels for the homeless, to bring up child care sites, to be the first in the state to do a stay-at-home order. All of that pre-planning has allowed us to get to the position where we are today, in which we are leading the state in COVID response in the state of North Carolina. So, yeah, we triggered it, and we waited a couple of days to tell the public about that, but that was all part of our planning process.
Ms. Heron, this is Rubin from Spectrum News. We've heard some differing information over the past few weeks nationally in terms of whether people should be wearing masks in public. What is your recommendation to people in the county? Should they be wearing masks? And if so, where should they be getting them?
That's a really good question, and we don't have definitive answer around that yet. There have been several high-level individuals who have suggested that it may be useful for everyone to wear a mask. We are expecting some guidance from the CDC later this week or early next week around that. But what I want people to understand that for the most part, wearing a mask is not going to be terribly protective of the individual who is not COVID positive. The masks really serve to keep you from infecting others. It stops the particles that come from your mouth and your nose that can affect others. But for individuals who are in a situation where they are not positive, there may be minimal protection, but that's not the significant use for a mask at this point. And I want to reemphasize what we have been saying from the very beginning of the situation is that it is terribly volatile Information's changing every minute. We're learning more about this infection and this virus as we move forward. And so it's not, I mean, as you've seen, guidance has been changing almost daily since we started with this. So I would not be surprised if at some point in the near future we understand that masks would be recommended. Now, the bigger question is where people can access those. There are a lot of people who are making cloth masks, and there is some indication that they may be helpful for people who are infected or who may be infectious. So those are things that we're looking at carefully, and again, we're looking to our federal experts to give us some specific guidance on that.
Yeah, I know yesterday.
WDTV. Can we get just a little more information about the two officers that tested positive? Was this a situation where they were exposed during work?
The short answer is that we don't know. And as I said earlier, we're working very closely with our healthcare providers and professionals in order to determine that. What I can tell you is that they have been quarantined. Their cleaning initiatives have been taking place to ensure that we do our best to ensure that no further exposure takes place. So we are very cognizant about our employees and our officers' health and well-being. And I can assure you that we take it very seriously. So we don't have an origin for their exposure just yet. What I do have is that a method and means of moving forward to make sure that their health and well-being is taken care of, as well as our other officers and employees.
Deputy Chief, what is your view on hazard pay for your officers? I know other cities have enacted hazard pay. Now we have CMPD officers infected with this. What is CMPD's stance on hazard pay, and will it be something that we would be looking at?
Yeah, there's a couple of points there. One, those decisions are made above me and for differing various reasons. Our officers, I've been a police officer for 28 years. I have seen all of our officers, they do hazardous duty every day. So in that vein, I am proud of the way that we have operated, both as a department, as well as part of our emergency management folks, our medic folks, and all of our first responders and healthcare providers. So I'll leave that decision to those who are above me and smarter than me, but I tell you right now, I'm proud of the work we've done as a team so far.
Hi, this is Glenn Durkins with Q City Metro. I have a question for Ms. Harris.
Yes, sir.
Yes. Can you tell us more about the marketing effort, the outreach to the Black community, what that involves, and anything else you can give us about the demographics and how this virus may be affecting the different communities differently?
Well, I'll start with the demographics. I mean, as we said, there's a larger percentage of African Americans over the age of 60 that are testing positive versus the younger set, which is the flip side for most of our other populations. We do believe that a good reason, there's several reasons for that. One is the fact that we are testing individuals who are symptomatic and who are having difficulty dealing with this infection. And those are people over the age of 60 and people with underlying health conditions. We know that our African American community, if you look at our statistics, are 3 times more likely than whites to have chronic underlying conditions. So it makes sense that they would be individuals who are more affected by the serious complications of this disease and are more likely to be tested. So we don't think that it has anything to do with increased susceptibility at this point. What we're in the process of developing some materials that we'll be getting out through our African American churches, as well as other churches that interact with the elderly, to make sure that that message is getting to them about what they need to do to take care of themselves. And also, we're looking at working with our organizations that provide support for the elderly to see what we can do to make sure that those individuals who we've asked to stay home and not come out are getting the services that they need to be able to sustain themselves at home. So those are our efforts at this point. We are wide open to any other suggestions that the community might have in terms of being able to get information out and also ways to support that population.
Quick follow-up. Do you have a time frame for getting those materials out?
Next couple of days is what I'm being told right now.
Thank you.
You're welcome.
Ms. Harris, it's Derek with Fox 46. Question real quick in regards to the stress levels that have been placed on public health and also what you've been seeing from the hospitals. Talk to me about that. I would bet you probably had a chance to speak with doctors, surgeons, nurses, a little bit of everyone over the last couple of weeks. How is it getting at this point?
Well, I think many of us that work in public health and emergency management, law enforcement, and a number of other entities in our community are used to responding to emergency situations. But what typically happens, whether it's a hurricane or an ice storm or a flood, whatever that situation might be, it is usually a fairly short timeline that we have to deal with that situation, and we're in and out. This is, we've talked to all of our staff about the fact that this is a marathon, it's not a sprint. And if you look at the curves that you saw earlier, this will last into another month or two. We are not anywhere close to the end of this, unfortunately. And that day in and day out wear and tear on individuals can be difficult. We're trying to do everything we can to support our staff to make sure that we've got redundancy in the different roles that we all play. That's not always easy. Day in and day out, I'm having conversations with our first responders about individuals or their staff who have been exposed and the concerns and the issues and the anxiety that they have about the work that they're doing. We know the same exists for all of our healthcare providers who are taking care of individuals in our hospitals every day. And I have staff, limited staff, who is having conversations on a daily basis with those folks who are infected, trying to make sure that they are isolating, that they're taking care of themselves, and that they have the resources they need. So, yes, this is very stressful, and it just helps emphasize how difficult as well as how stressful and serious this situation is. It is taxing our system. That does not mean that we're not responding. We're doing the planning that we can do. We're providing the support for all of the folks that are working in this as best we can. But we need everybody's help. I know we've said this several times today. Everybody in this community has a role to play in this. And the better you play your role, the quicker this will be done. And we'll be able to get back to normal.
Ms. Harris, as far as the field hospital goes, I know yesterday you said it's really dependent on if we can get adequate equipment, including PPE, before it opens. I know this is underway now, but with the news that, a recommendation could come for all Americans to wear these when they are out doing those essential things, how concerned are you that this will have an impact for our field hospital being put up?
Well, we're doing everything we can here in Mecklenburg County to make sure that those who are most at risk have the protective equipment they need. So that's our medical providers as well as our first responders. Others who are still interacting with the community because the services they provide are essential, we are trying to make sure that they have surgical masks and the protection that they need. So there's prioritization of the use of that kind of equipment and supplies. That will continue and probably get a little tighter as we move forward. Our hospital systems are looking at ways where they may be able to reuse some equipment and supplies. That's happening across the country as well. And we have a whole section in the Emergency Operations Center who is every day looking through lots of different websites and advertisements and individuals coming forward saying they can provide resources for us and making sure that those resources are what we need. So we're putting as much effort as we can into making sure that everybody has the equipment and supplies they need.
I just want to add one more piece to that around the PPE. I just want to make sure everybody's aware that Mecklenburg County is not immune to the shortages of PPE in vents across the country. And so to Gibby's point, we have people who are working night and day to try to get us what we need, and Chief Graham can talk more about that. But again, we are no different than any other place in the United States of America that is struggling to get sufficient supplies of PPE and vents. And Chief Graham's going to give you a little more on that.
Yeah, so I just stepped out to take a call from Director Mike Sprayberry from North Carolina Emergency Management as we were doing this press conference. We talked about it this morning. We know that there's a shortage nationally, but the state is also in a shortage. They've got requests in to the national level and our manufacturers, and they're doing everything they can in Raleigh to get it from North Carolina. North Carolina, in turn, is doing everything they can to get it specifically for the hot spots in our region, and Charlotte is a hot spot. We have local logistics folks that are assigned to look for any and all personal protective equipment that's out there. And of course, our priorities right now are acute patient care practitioners and our first responders that are out on the street. And so we're doing everything we can. Eventually, the supply chain lines will fill back in, but it's going to take some time. And so we're looking at it. We're looking at our burn rates. We're reviewing all of our standards and all our procedures that are out in the field, and we're doing the best job that we can to take care and manage a finite amount of resources that we have currently, and then request those resources through the state and federal government.
Considering that Charlotte is a border city right on the side of South Carolina, and South Carolina is doing a stay at home, the fact that they just finally this week closed nightclubs and bowling alleys and whatnot, how much of a concern is that for you that they're actually just coming into Mecklenburg County not under a stay at home? And also, how much do you expect their residents to impact the hospitals here in terms of trying to seek care?
Well, I do think one of the challenges that we've experienced is that there are a number of different stay-at-home orders, and they all don't look exactly alike. So what can happen in one county can't happen in another because of the way the order was written. We've been working through those issues as best we can in our county. We're really strongly encouraging individuals in this community not to go to other counties to do things that they can't do here. We need them to obey the order that we have in this community that will help us flatten that curve, as we talked about earlier. And we also know that our hospital systems serve as regional systems. They don't just care for people in Mecklenburg County. And the curves that you saw that were shared a little bit earlier include the populations from those surrounding counties that our hospitals tend to serve anyway. We need to be prepared for that because we'll never at any point close the borders to tell people they cannot come in for care.
Bother you that South Carolina is not under a statewide state?
Well, that is concerning, but that's a decision that their governors had to make. And again, we'll continue to work with our community as well as with law enforcement to make sure we're doing what we need to do here in Mecklenburg County.
Gabby, I had a quick question about some of the data behind the patients who are hospitalized. Are you able to share a little bit more about what those patients look like age-wise, race and ethnicity, as well as do you have any data on the amount or the number of people who have recovered from COVID-19 here in Mecklenburg County?
I don't have the specific number. You will see in the data that you get a little bit later this afternoon the percentage of folks that have recovered. I think we're looking at, well, I don't have that in front of me right now, so I don't want to misquote. In terms of hospitalization, I will say that the majority of the individuals that are being hospitalized are over the age of 60 and have chronic conditions. That doesn't mean everyone. We do have younger individuals in our hospital systems who are having serious illness to this disease. So again, this is an infection that does not play favorites. It's an equal opportunity infector. So we need to make sure that everybody's paying attention and doing what they need to do to protect themselves.
You weren't happy last weekend after so many people came to the parks. Obviously, measures were taken this week to try and prevent people going on playgrounds and things like that. But if you see a large number of people at parks this weekend, are there additional measures the county could take, including a curfew?
Deena, do you want to speak to that?
I mean, there are always additional measures that we can take if we continue to see large numbers of people in the parks. We have gone into the parks. We've put up a number of signs in the parks to encourage people to practice social distancing, but we'll monitor it, and if we really feel like it will be beneficial to flatten the curve by closing our parks, it is something we'll consider, but it's not something we'll take lightly, because we are encouraging people to get outside, get fresh air, do some exercise. So it's really a balance that we have to strike, but it's something every day is different, as Gibby said, and we'll continue to evaluate the situation and make decisions accordingly.
Ms. Diorio or Ms. Harris, earlier today the mayor said that a public transportation ban is possible during the surge. Is that something under serious consideration right now?
Did you
essential workers who rely on the bus or late?
So you indicated that the mayor said that the transit system, the transportation system may be shut down. Is that what you asked?
She said that the public transportation may need to shut down during the surge.
Well, I have not heard that. It has not been communicated to me.
So that's not being considered right now?
It's not being considered as part of the planning group that we talk to, that we meet with every single day. That is not something that has been brought up for us to consider.
Deena, it's Allison from The Observer. Can you talk about how the stay-at-home order might have stricter enforcement moving forward, and how 311 is receiving numerous phone calls every day, how those 311 calls are prioritized to enforce social distancing and other gathering guidelines?
So, I can ask Chief Estes to talk about that. He's really our point person with 311 and how they're managing the complaints that they're receiving.
Thank you. The 311 system is our main way that people can call in to report violations of the proclamation. The way we do that is many times that when they come in, the call takers are able to screen out just a quick question and answer session with the caller to determine what the complaint is or what the misunderstanding is. From there, if the 311 call taker determines it to be a legitimate issue needs to be followed up on, there's forms that are filled out, and then it's routed to the police department, who then further investigates the issues or complaints. Again, a lot of times a phone call or even a visit can handle those. This is not unlike what we do every day for issues prior to the pandemic. So they're prioritized based on what we see the call says, and the variables are too many for me to enumerate here during this conference.
It's Derek with Fox 46. Question for Ms. Diorio. I'm interested in hearing more about the, for lack of better words here, the marketing efforts you guys are doing for the social distancing. You mentioned the use of possible social media influencers or using your social media to get the word out. Tell me a little bit about what that involves. If you guys are using influencers, are you guys using anyone local? Who are you using to actually help get that word out?
Yeah, I'm going to ask Gibby to respond to that. Thanks.
Okay.
Yeah, we have been using influencers through social media with our HIV efforts to reach certain populations, especially younger populations, and we're finding that to be very effective. So we have been in conversation with some of the ones that we're already using, as well as looking at others, to be able to get the message out around social distancing and the need for them to take this as seriously as everybody else in our community. So we're starting to expand that and look at how we better use that resource, because, as I said, in our work around HIV prevention, we found it to be a very useful source of messaging.
Follow up to that. Are we talking about anyone specific celebrity-wise? Are we talking anyone notable community figures? Anything specific to that effect?
I don't have the specific names with me at this point in time. I can work with staff to make that available.
Okay.
The county didn't take any action to address the warming concerns that were brought up last weekend. Or do you have any concerns going forward this weekend about the sandbars?
We spent a lot of time this week talking about the lake and the sandbars, and Duke Energy has been a great partner with us to have regional conversations with all of the localities that have shoreline on Lake Norman specifically to talk about how we're going to manage activities on the lake. And so far, there's been no consensus to close any of the boat launches, but we do have lake patrol on Lake Norman as well as Lake Wiley and Mountain Island Lake to manage those activities on the lake. And so we got feedback from our local law enforcement last weekend, and I think we might have reported that out at one of these news conferences, that they felt they could handle the activity on the lake. The sandbars have been closed, but they can handle the activity on the lake. And so we'll continue to monitor that, and we will work with our other surrounding counties on that. The concern is if Gaston County closes its boat launches, then people are just going to come to Mecklenburg to launch their boat. And so we really believe it needs to be something that is done with all the municipalities that have shoreline on the lake.
Deena, has there been any outbreaks that have taken place in our nursing homes or an abundance of cases hitting our nursing homes?
We are monitoring that very closely at this point in time, working with all of the long-term care facilities in our community. We have had one where we've seen at least 3 cases. So we're working with them right now. They're implementing everything they need to protect the rest of that population. But I do anticipate that's a potential concern for the future as well.
We can take one more question if anybody has one.
Deena, this is Heron Rubin from the Charlotte Business Journal. I have a question for Gaby, please.
Sure.
Just wondering if you could give any more specific updates on testing availability in the county, what those numbers are looking like now, and how you're continuing to make it available to people.
So at this point, our best guesstimate, because we've been working on collecting that data, is during this event, there's been over 1,200 tests done just between the 2 hospital systems and their sites. There are others in the community that are testing that we're not getting information from specifically about tests completed. So we know that we've done about that many. But what I will tell you is that based on CDC and state guidance and the availability of testing at this point and quick turnaround, we are in agreement in Mecklenburg County that we are limiting testing to those individuals who are most at risk, especially those who are inpatient, and it may determine the course of their care, as well as our first responders and our medical providers. So we are continuing through those systems to virtually assess individuals before they're even brought to testing sites for testing at this point in time. We do know that the availability of the quick tests that you've heard about in the news may be coming our way in the next couple of weeks. We don't know how available it will be, how much that will be available to us, and that could change the picture some in what we're able to do in terms of testing. But right now, we continue to be quite limited.
Thank you, everybody.
Welcome back to our latest edition of Recruiters on Your Computer. I am your host, Brad Koch. And for those astute viewers who recognize the one on my immediate left,
that's right.
Your name is?
Christina Frazita. I'm back.